So I'm particularly interested in what's going on with cancer patients right now. And this one's kind of personal for me. I am a stage 4 cancer survivor. I survived cancer in 2001. And full disclosure, CTCA actually gave me some naturopathic counseling that really helped me recover from pretty extreme chemotherapy treatments that saved my life. And I'm looking at COVID-19 and the real threat that it represents to all Americans, but specifically cancer patients. But compared to what's happening with COVID, we need to keep in mind that cancer itself is the #2 killer in the world. Can you give us a sense for some of those numbers?
So to give you some perspective, cancer is the second leading cause of death in the world. Approximately 10 million people, unfortunately, will lose their battle to cancer every single year. In the United States alone, that number is close to 700,000 deaths from cancer. So this is the very definition of a life-threatening illness. It is the battle of a generation. It is one of the most horrible diseases that we are fighting as medical professionals and as humanity.
So right now, given the unknowns of this virus, it really puts cancer patients in a uniquely risky position. Can you explain why?
Yeah, cancer patients are, like other diseases, have a immunocompromised status, which basically means that their immune systems, the cells in our body, the system in our body that fights off infection, is weakened because of the cancer itself, the way that it works, and sometimes can be further weakened by the treatments that we have. So cancer patients find themselves having to navigate this difficult question of should they contemplate delaying their care or deferring their care, as sort of the confusing messages around COVID have swirled. So cancer patients are in a unique position as we navigate this pandemic.
Given concerns about the risk of exposing immune-compromised patients, but also trying to manage the flow of COVID patients, a lot of governors and the Surgeon General and a number of hospitals have deemed a lot of cancer therapies elective, along with other elective surgeries and procedures. Is that really a smart play, given that delayed treatment could make a treatable cancer into a deadly cancer?
Cancer is the very definition of a life-threatening illness. It is at the top of the list of a very serious life-threatening condition that is also simply one of the most common diseases that we face. 1 in 3 Americans will be diagnosed with cancer during their lifetime. So yes, we are in this war on COVID, but we cannot turn our backs on the war on cancer. To give you some more specifics, every single month, approximately 20,000 women will be diagnosed with breast cancer. Every single month, another 11,000 will be diagnosed with colon cancer. So if you just look at the last 2 months of this COVID pandemic, it's quite possible that 20,000 plus 11,000, so roughly 60,000 patients could have had a delay or a miss in their diagnosis of cancer. So we cannot afford to miss those cases. The bedrock of cancer therapy, Matt, has been early treatment, consistent treatment, and complete treatment for the last couple of decades. That is the tried and true way to defeat cancer. What we know for sure is that if we don't treat these cancers, the patients unfortunately will die. So much of medicine and public health is really a question of risk and benefit analysis. It is constantly weighing those things. Sometimes during a crisis, people forget one side of that equation. People only think about the risks as opposed to the benefits. It's a well-documented phenomenon. Policymakers do it, executives do it, doctors do it. it's well chronicled that if a physician is hearing a lot about a certain case, or they've got something on their mind, they're more likely to be focused on that rather than really thinking about the risks and benefits. So ultimately, Matt, I think it is very important that cancer patients continue to get their treatment as much as possible. Cancer, there are many things we do in medicine that are elective, that are cosmetic. Cancer is not an elective procedure. The treatment of cancer is a life-saving intervention. It is not something that should be delayed. And so I think it's very important that the cancer patients continue to be diagnosed, continue their treatment, and continue their surveillance.
Now, your business is specialized in the sense that you only treat cancer patients. So I assume that the protocols in place for immune-compromised cancer patients are always particularly rigorous in your hospitals. What does that look like, and how does it apply now when the threat is even greater?
So at CTCA, cancer is the only thing that we focus on, and it's all that we focus on. So with respect to the COVID-19 pandemic, we have a unique position in that we are able to continue to focus only on cancer care and really make sure that we are maintaining the highest of standards and the safest approach to treating cancer. So we've taken a long list of measures. We've established a perimeter. We've reduced visitors. We have a single point of entry to make sure that everyone entering our facility can be screened, can have appropriate masking done, have their temperature taken. We've also acquired rapid testing so that we can test patients to ensure that they do not have COVID. So we've taken so many precautions to do this. And what's nice about our facility is because we're not located in the epicenter sort of downtown portion of a city. We're located just usually outside of the main urban center. We're a little away from sort of where unfortunately the COVID pandemic is hitting, and so much so that many other hospital CEOs have called me and said, we think that's a safer environment. Can we transfer patients to you? Can we free up some capacity so that we can focus on COVID and you can continue to take care of our cancer patients? So we've taken every single precaution to ensure that our patients are safe, but at the same time are able to get the life-saving therapy that they need.
So CTCA has actually stepped up and offered to cancer patients and doctors and hospitals an alternative opportunity to treat patients. Why did you do that?
Well, Matt, I think one of the things that we share is a belief that this is an amazing country built on a bedrock of principles, and I often think during this crisis about, what is the best for our country? What is the best for our health system? Certainly, what is the best for our patients? There's a quote that has sometimes been misattributed for its author, but there's a quote that I love, which is, "America is great because she is good. If America ceases to be good, she will cease to be great." I think it's during times like this that leaders of all stripes, from medicine to business to government, need to step up, need to be a part of the solution. So we have an opportunity here where our focus is on cancer. It is what we do. We are one of the best in the world at doing it. And it was the right thing to do. It was to be a part of the solution, to reach out to other hospitals and say, you're doing the great work of focusing on caring for COVID. We can help to continue cancer patient care, make sure those patients don't get disrupted, have them transferred to our care, and that can be a win for the patients, a win for those other hospitals, and a win for the healthcare system in general. frankly, I think that it's a model that I hope sticks around for some time because our healthcare system is just way too fragmented. There's not enough teamwork to really solve the larger grand solutions in healthcare. And I think this was a great illustration of working together to solve a bigger problem. So this whole notion of flattening the curve has never been about eradicating the virus. Flattening the curve has been about giving the American healthcare system enough capacity to handle the very sick patients from COVID. And so in order to be a part of that solution, we know that if there was a hospital that was being inundated with COVID, they have other patients who need life-saving therapy, cancer patients. And we could be a part of the solution by helping them free up their capacity by taking on the care of their cancer patients. That would free up more of their space so they can take care of the COVID patients.
So let's put a human face on this. We're talking policy and we're talking infrastructure, but really this is about people who are trying to get the treatment that may in fact be the difference between life and death. Can you tell me some personal stories?
Sure, Matt. During this crisis, I've had the opportunity to talk to dozens of cancer patients myself, in addition to the hundreds and 1,000 or so patients that we've had the pleasure of giving care to. I'd like to share a few of those stories with you. There's so many that stand out to me. One is a woman in Oklahoma. Her name's Robin Roberson. Gave us permission to tell her story. She's a public servant in Oklahoma. She was diagnosed with breast cancer, and she knew that she had a history of breast cancer in her family and that her cancer was aggressive. Unfortunately, she was facing, like so many other cancer patients, was facing a delay in her treatment. And so she called, and her doctor called Cancer Treatment Centers of America, and we were able to get her in very quickly, perform her double mastectomy surgery, and get her the care that she needed, in a timely and comprehensive fashion. So, very emotional to have a chance to get to know so many stories like Robin's. There's another woman who was a 72-year-old grandmother. I remember meeting. She had survived her cancer once before. She'd lost her husband to cancer, and she had come to our hospital in the Chicago area because all of her imaging had shown that she had a tumor, an aggressive tumor, but her facility that she normally got primary care at was unable to perform the biopsy and the surgery. She wasn't willing to wait, and we felt that it was definitely an aggressive type of cancer that should have been treated. So we got her in literally the next day, did the biopsy, and she received the results. It was stage 3A adrenal carcinoma, and she's already getting radiation therapy, and hopefully will be on her way to recovery. So these stories are so common, Matt, and I see a combination of things during this disruption. I see facilities or doctors that want to be able to provide care, but some sort of monolithic statement is either being misinterpreted or interpreted correctly, and patients cannot get in. I'm also seeing patients who are getting confusing messages about delaying their treatment or things like that. And then I'm also seeing patients who are not wanting to go to a location that might be overrun with COVID at the moment, and they want to go to a cancer specialty hospital. So have really had a chance to meet a lot of these patients. Another category are patients who are undergoing clinical trials, which is one of the key principles in us defeating cancer. And we've had, probably a dozen cancer patients that we've made sure continue on their clinical trials during this period because it's essential to their, to their livelihood. So, it's very important that we continue our our comprehensive therapy. It's very important that we continue patients on clinical trials. And as critical as the COVID-19 pandemic is, not take our eye off the ball of treating cancer.
Those are wonderful stories, and I imagine that those stories are going to continue to fulfill themselves in ways that I hope people start appreciating the really tough trade-offs when we make certain decisions, particularly from the top down. And that's sort of where I want to go with my next question. I've been reading lots of stories about entrepreneurs and community leaders and volunteers wanting to step up and fill gaps and solve problems during the COVID-19 crisis, only to run into regulatory barriers and rules and red tape. Are you experiencing that in your business as well?
We are. Before I get to that, I just, the question you gave me just kind of made me very passionate and emotional. I just wanted, there's two other stories that.
Well, let's start that over.
Yeah.
Let's just keep going with the stories.
Yeah, let's do that. There's a woman who is halfway into her battle with cancer, halfway into her treatment, and she was going to another facility, frankly doing pretty well, and that facility had told her again, we're treating you early, we're treating you consistently, and we're going to treat you comprehensively. And she was going in to get her IV chemotherapy, and the doctor told her that even though he felt that she should be continuing to get her IV chemotherapy, that the facility, some rule at the facility was not allowing her to get that done. And essentially that there was nothing he can do about it. As you can imagine, she was emotional. She was livid. She was sad. So, we were talking on the phone and we got her in for care, but it's stories like that again, there's not a one size fits all solution. In healthcare, when you have so many other life-threatening illnesses, you can't just all of a sudden shut down cancer care or cardiac care or stroke care. I talked to a gentleman who is a friend of a executive that she connected me with, and he was about 5 weeks into his diagnosis, had the first round of treatment, was supposed to go in and get the second round of his therapy, and they said they couldn't take him. When could he get in? They weren't sure. Likely, a month from now. And I talked to this guy, and he shared his professional story. Tough guy, and he broke down crying, saying, this is the most scared he's ever been, having to deal with this horrible disease of cancer, getting these confusing messages, and then having been told 2 weeks early that he needs to get his therapy and get it fast, and all of a sudden now that he should wait. And again, these stories, they make me very passionate and compassionate, because we have to constantly be about the patient. And too often in this in our healthcare system, and certainly during this time, we don't always put the patient first as a healthcare system. So that's the principle that we've deployed here at Cancer Treatment Centers of America, is always do what's right for the patient, and look at each patient individually in their care.
As a survivor, as someone that has sort of a personal mission, as we all do, to make sure that every cancer patient gets the care that they need, this idea that for reasons outside of your control, you would simply be denied one day, and you can't pin that decision on any specific thing. Those are horrifying stories, but I love the fact that you've come up with solutions, and I think it's got to be personal. It's got to be about individuals. It can't just be data on a spreadsheet.
That's right. It can't just be data on a spreadsheet. It can't be a one size fits all. It can't be a big on button, or an on switch or an off switch. It really is, so many the great doctors always think about the risks and benefits. There's times when you don't do procedures. I've had patients in the past who say, Pat, I really want to get this surgery, for something non-cancer related. Say, well, you really ought to think about that. There's risks of infection, there's risks of bleeding and things like that. But on the other hand, COVID is an incredibly serious public health issue. It presents a risk to all of us. But again, cancer is one of the riskiest diseases in the world. It is with certainty going to, kill patients who have it at some point in the future. And the idea that patients with heart disease, patients with cancer, patients with these other major leading causes of death would be disrupted is tragic. I think it's unfortunate that in some cases this debate has begun to take the form of lives versus economy. I don't see it that way. I see it really as a debate of lives versus lives. And only then can we really arrive at the right solutions, both at the macro level and the micro level, if we think about it as lives versus lives. So, I think that's just a really important thing for us to remember.
As someone that would be generally skeptical of any one-size-fits-all top-down solution to any problem facing humanity, I'm seeing really interesting stories of entrepreneurs and individuals and volunteers and people in their community stepping up to solve new problems that have been created not just by COVID, but by top-down mandates. And they run into red tape and they run into rules that sort of prohibit problem solving. I assume you guys are running into some of that as well.
We are. In times of great crisis, you need tremendous innovation, right? And if you stifle that innovation, you really stifle the ability to get solutions. So, to give you a few examples that we've seen, just in some basic areas of too much red tape, we are the only national cancer provider. We're the only national cancer provider in the nation. We're taking care of the sickest of the sick, patients who need to come in and be cared for. And we, like so many other hospitals, were trying to acquire personal protective equipment, basic things like gloves and masks. And one of the issues that we ran into was we had a shipment of what's called KN95 masks that were coming in. We'd ordered approximately 30,000 of them to protect our doctors, to protect our nurses. And 2 days before we were supposed to get them, and this happened to many other hospitals too, the FDA said, well, we're going to put a pause on those. You can't use those right now. And so we frantically searched. We tried to acquire other masks. We literally had to pay a 500% markup. We were watching the price of masks change by the hour to acquire these. 2 weeks later, the FDA had said, actually, you know what, these masks are okay. During this entire time, we'd gone to the CTC website, which had continued to say that these masks were appropriate. In fact, the FDA notice had pointed us to that CDC website. So that, as you can imagine, for us and other hospital CEOs was incredibly frustrating. Another category of bureaucratic red tape has been in the technology and telehealth arena. Thankfully, some of this has been alleviated, but early on, the traditional telehealth rules were draconian. They were you weren't able to deliver telehealth across state lines, which is crazy. If you're sitting 30 miles away on the opposite side of the border, you can't get a telehealth visit. You had to use very prescriptive types of technologies without being able to do a lot of care. That's one that I think overall during this crisis we started to get right, but in the early throes of it, the telehealth regulations were remarkably restrictive. There are other just really frustrating issues around insurance. I'll give you a couple of these. Is we have this ridiculous patchwork of patient insurance and providers, and it's remarkable. There are some quote unquote not-for-profit insurance companies that receive millions in subsidies and kind of tax tax benefits that they get as nonprofits, but they certainly don't behave as nonprofits. And we've had patients that are out of network as a part of those plans, needing life-saving cancer therapy, and they were unable to get care with us even during this crisis. And just unbelievable red tape in that scenario, unbelievable lack of compassion on the part of some of those insurance companies. Now, I should say that there are other insurance companies that have been phenomenal, but there's a couple that even with their not-for-profit status have really prevented or care and been the barriers in care. So yeah, a lot of red tape that we've had to navigate here.
So I'm going to ask you about certificate of need.
Yeah.
So much concern about hospital capacity and making sure that we do flatten the curve so that hospitals are not overwhelmed. But there's this thing called certificate of need that has prevented the expansion of facilities and beds and all of the things that we would need during a crisis. Can you explain that? What is the rationale for that?
Yeah, as you said before, flattening the curve has really only and always been about getting enough hospital capacity as defined by beds and ventilators and critical care and other elements of capacity that we can weather the storm, that we can take care of the sickest of the sick during this pandemic. So fundamentally, if you think of that as a capacity problem, it's unfortunate when you look at policies or things that have restricted capacity. And so certificate of need policies are policies usually at a state level that essentially ask that a provider demonstrate a need for that capacity. Now, that obviously is a very tricky thing to do because the nature of some of these one-size-fits-all policies or sort of top-down solutions is they're trying to capture a solution at a single point in time. So even if you're right at that particular point in time, as life changes, which it always does, you could be wrong with that policy a week later, a month later, a year later. So even if it was true that you don't need a certain type of capacity in the year 2017, well, how do you know you won't need it in the year 2020, right? And so some of these programs or policies are, I think they're well-intentioned, but they're not well thought out, and particularly the unintended consequences, many of which we're seeing now, are hugely relevant here. So to give you another example, for a healthcare system that spends $3.5 trillion a year in the United States, for us to not be able to have protective equipment for our doctors and nurses, to not be able to have enough capacity to care for citizens in the greatest country on the planet is tragic and is indicative of many of the kind of perverse incentives in healthcare, the lack of transparency, just the some of the red tape that we talked about earlier. Okay, Pat, I really appreciate you taking time with me, and I know this is a particularly stressful time, and you guys got a lot going on, but thanks for stepping up. Thank you again. I appreciate you taking the time. I'm really it's a pleasure to talk to you personally, given your own battle with cancer. cancer, and despite your and in all these areas, you get it. I can tell by your questions. It's something that's very, very passionate to me, is that we forget at the end of the day that there is a human being, that these are not just statistics. This is a mother, a father, a son, a daughter that is dealing with one of the scariest, one of the most horrible diseases that humankind has ever known. And so thank you for what you're doing here and getting the message out. And I hope you're well.
Thanks for watching Kibbe on Liberty. By now, you know this is the most important event of your week. So make sure you subscribe on YouTube. Click the little bell so you get notifications. Kibbe on Liberty, mostly honest conversations with mostly interesting people.